Mhm. Okay. Welcome, everyone. We'll get started in just a few minutes. And just as a reminder, this webinar will be clearing the air about public charge. It's collaboration between the Tennessee Justice Center, the Tennessee Immigrant and Refugee Rights Coalition, as well as the Tennessee chapter of American Academy of Pediatrics. Feel free to put any questions you have into the Q&A box. The slides and recording will be distributed to everyone tomorrow. And also, please sign up for some of our other upcoming events. On October 28th, we'll be talking all about food assistance for immigrants and refugees here in Tennessee. We'll be talking about SNAP and WIC and PEBT. We'll also talk about those a little bit in this presentation. And then on November 17th, we'll be talking about ECF Choices, which is a program for intellectually and developmentally individuals, a way to get them TennCare and home and community-based services. So feel free to check out those upcoming webinars. And we'll be starting in probably about 1 more minute. Okay, so I'll go ahead and get started since we have a lot to get through. So just as a reminder, this webinar will be clearing the air about public charge. It's a collaboration between the Tennessee Justice Center, the Tennessee Immigrant and Refugee Rights Coalition, as well as the Tennessee chapter of the American Academy of Pediatrics. Please put any questions you have in the Q&A box, and the slides for this event and a recording will be distributed tomorrow. So I want to just begin by telling you all a little bit about the Tennessee Justice Center if you're not familiar with our work. So we are a nonprofit public interest law firm, and we use individual client representation or casework, both healthcare related as well as nutrition related, to identify systemic risks to state safety programs. And then we advocate for change through legislative action and class action litigation, as well as we do advocacy on both the state and the federal level. And through this advocacy, we seek to change policies. And this webinar is part of our advocacy efforts. So in today's webinar, we'll be starting with a landscape of public charge, which will be given by the Tennessee Immigration and Refugee Rights Coalition. Then we'll talk about the chilling effect from the provider's perspective, as well as a little bit about nutrition, safety net programs. And we'll also be talking about public charge and Latinx families. Both of those will be presented by the Tennessee chapter of the American Academy of Pediatrics. Then I'll be talking a little bit about the chilling effect we saw in terms of child uninsurance rate. And then we'll end off with a little bit more about nutrition safety net programs. Hey, Judith.
Thanks, Evan. Good afternoon, everyone. My name is Judith Clorjune, pronouns she, her. I am the Campaigns and Advocacy Director for the Tennessee Immigrant and Refugee Rights Coalition. So really excited to be with y'all tonight to talk about public charge. Recently, one of our attorneys was helping someone file for citizenship, and they were thinking about applying for the fee waiver. But unfortunately, because of the public charge rule, they hadn't applied for any public assistance because they were afraid, and it became so much harder for them to prove that they were actually in need of the fee waiver. And so just not little, but instances like that really show us how important or impactful the public charge rule has been over the past couple of months and couple of years. And so really wanting to have this conversation tonight. And so should I continue or pass it to the rest of the panelists to introduce themselves before moving on?
You can continue.
Okay, all right. Yeah, and so we will start. I'll start with a quick history of public charge. As some of you may already know, public charge has been on the books for hundreds of years now, right? It was originally introduced in 1882 as part of the Immigration Act of 1882. And so essentially public charge is a law or a test that the US government uses to determine whether someone entering the country or someone who's applying for a change in status would become a public charge, right? As in someone who would become primarily dependent on government assistance. And so it's really, really important to understand that context of where the rule came from. And so quick history, back in 1882, our immigration system wasn't, or rather was still very exclusive. And so right after this Immigration Act of 1882, we saw the Chinese Exclusion Act. And so a lot of the bills and laws that were being passed around that time were trying to restrict who could come into the country, as well as who could, apply to become an American, quote unquote. And so it's really helpful and critical for us to understand this context of where this public charge rule came from and how we're seeing some of that being reflected back in recent months. And so fast forward a number of years, in March of 1989, the immigration, I believe, INS essentially published a field guideline to update how the country and how public charge was being used. And so the current public charge rules are based on the 1999 field guidelines. And so we'll go a little bit into the timeline over the past couple of months and how we've gone back and forth. But essentially, the rule was created in 1882, wasn't updated for a number of years. Then additional guidelines were provided in 1989, and we're currently still under those guidelines. All right, if someone would move to the next slide, please. Thank you. Yeah, so that as you can see on the slide, a lot has been happening regarding public charge. And so quick history, in 2018, when the previous administration took office, one of the first changes was to change the public charge rule. And so initially, before the rule was officially proposed and then finalized, there were a lot of rumors going around, right? And we were hearing that maybe the public charge rule might impact US citizen kids. It would really restrict the types of benefits that people would be using. And so from the get-go, this was really based on a culture of fear, right? Yeah, and so I won't go into all of the details of month to month. If people want to access this timeline, it is available on the Immigration Legal Resource Center's website. And so please feel free to go there, and you'll have access to a lot of that information. Yeah, and so March, I believe, of early this year in 2021, the rule was officially repealed. And if you can go to the next slide, please. There we go. Yeah, so the Trump administration's public charge rule is no longer into effect. And DHS has stopped applying that rule to the cases that are being processed as of March of this year. And also In March, the DHS officially went back to the 1999 INS guidelines. And so those that were published are the guidelines that we are currently operating under. And so also this summer, DHS announced an advance notice of proposed rulemaking. That's a mouthful, but essentially looking at making some proposed changes to the public charge rule. And right now, the Protecting Immigrant Families Coalition, which is a coalition of a lot of state and national groups working on public charge, they are working on compiling comments from different national as well as state level organizations to make sure that we are providing feedback on what kind of rule we would like to see. As we know, the public charge rule has a lot of impact on our communities, right? Both what the rule actually does and says, and the fears and misinformation that people have been hearing and we're hearing for the past few years. And so it's going to be really critical for us to be involved in that process and have a say in what that rule will say. And to keep in mind the history of the rule, right? So thinking back to why it was created in the first place. And so it's really important for us to reimagine what is the utility that we want that rule to serve, what is the purpose, and what exactly do our communities need in that sense. And so that is the general overview of actually hundreds of years of history. But again, all of this information will be available to you all. And if folks have questions, the IRLRC website is really a really good source of information, as well as the Protecting Immigrant Families website. And you are always open to reach out to myself at TURC or TJC or any of the panelists for more information. Yeah, and so I will pass it to the next panelist who's going to share more about how this has been showing up in people's lives, how the chilling effect has been impacting our communities.
All right, so I'm Sarah Tremieux. I am a pediatrician. I trained in Vanderbilt and worked in the Nashville community for a couple years, and now I'm a community pediatrician in Chattanooga. I'm part of the American Academy of Pediatrics, and we this past year had formed an immigrant health committee, so I'm one of the co-chairs for that. So I was very excited when this webinar was going to be coming out to have an opportunity to speak on behalf of pediatricians in the state to kind of give a perspective of what we have seen with public charge in the immigrant community. Let's see, we can do, yeah. All right, so just an overview. I'm going to talk about some clinical observations on immigrant families when public charge came out, discuss the widespread chilling effect that we've seen with public charge on immigrant families, including use of benefits as well as pandemic care, discuss the importance of important benefits such as WIC and SNAP, and then discuss some strategies on how to talk to families about public charge. So this slide shows the timeline of public charge. I wanted to highlight, Judith did a great job kind of discussing the history. This slide here kind of shows you a big snapshot. So although the new public charge was effective for a little over a year, there was actually about 2.5 years of proposal, discussion, amendments. So since September 2018, there has been created a lot of fear in the community as policymakers were discussing what was going to be included and how it was going to be implemented. Let's see, next slide. Let's see, can we go to the next slide?
Flip the pie chart.
Oh, there you go. All right. So I remember when the proposed public charge came out. Oh, you can go back one.
I think there's just
There
a
you go,
delay
yeah.
with my slide.
And I was in a conference in DC in 2018. And this just shows a diagram of kind of past things that were included in public charge versus things they were considering to add. And so in addition to supplemental security income, cash assistance, and institutionalized long-term care, they wanted to add non-emergency Medicaid, food stamps, housing assistance, and Medicare Part D. And the proposed rule created a penalty to those applying for a green card, was specifically if you used one or more of these benefits for more than 12 months within 36 months, there could be a penalty in obtaining your green card. So the initial proposals were very concerning to me, realizing it may punish immigrant families who were using benefits that helped with their well-being, such as food stamps. And with all the drafts and legal terminology, it was challenging for me to keep up and to know what to tell immigrant families I was seeing in clinic. And I knew that if I felt confused, many other people in the community probably felt similarly. And although the final public charge proposal was more narrowly defined, that time period of those several years was filled with a lot of anti-immigrant discussion and instilled a lot of fear and mistrust within the immigrant community. Next slide. So I wanted to re-emphasize that most immigrants are not subject to public charge. In this pie chart, which represents different types of immigrants, only a small category, which is represented by the yellow section, those that are applying for a green card within the United States, are subject to this public charge rule. However, fear extended to many immigrants, including DACA recipients, legal permanent residents that already had their green card, naturalized citizens, humanitarian immigrants, people on temporary protected status, and undocumented. So this is what we call the chilling effect, and when the fear is extended to many people who the policy did not apply to. Next slide. So how is this relevant in Tennessee? Since the 1990s, we have seen an increase in immigrants. As you can see in this chart, in 2019, nearly 1 in 5 children lived in a household with an immigrant parent. Next slide. In addition, many Tennesseans live with an undocumented immigrant. Over 120,000 adults and children live with an undocumented immigrant, including 72,000 children with an undocumented parent, and nearly 18,000 US citizens in Tennessee with an undocumented spouse. So this affected a lot of people in our state. Next slide. So during the initial public charge proposal, I was working in the Nashville area, and I was seeing a predominantly immigrant population as someone who speaks Spanish, and I saw a noticeable decline in both medical visits for sick and well visits. Unfortunately, vaccine rates also dropped in that population, which put them even more risk at illness. And based on my discussion with families, especially mixed immigrant status homes, public charge and the fear of jeopardizing their immigration status did play a factor. And it was particularly frustrating to see US born children not receiving services. Next slide. So as a pediatrician, it was especially challenging to see FEAR extend benefits not included in public charge, such as SNAP and WIC. So as many of you may be familiar, SNAP stands for Supplemental Nutrition Assistance Program. This is a federal program that provides nutrition benefits to low-income individuals and families to purchase food. So these are food stamps. WIC is Women, Infant, and Children. It's a federal assistance program for nutrition to low-income pregnant women, breastfeeding women, and children up until the age of 5. So this is a very vital resource. They give a lot of nutrition in terms of food disbursement, health education, a lot of support services with breastfeeding parents. And as a provider, I know that some of my TennCare patients would be at risk for food insecurity without these programs. As many of us know, formula is expensive, and parents come to visits with their WIC forms in their hands, ready for them to be signed when they see me. And no parent should have to decide between paying bills versus feeding their child. But unfortunately, some parents did contemplate feeding their child versus interfering with their citizenship. And that was just really an unnecessary burden for any parent. And there's actually going to be another upcoming seminar on SNAP and WIC, which is going to go into the wonderful benefits and logistics of that. So you'll hear about more of that in the future. Next slide. So as I mentioned, food insecurity. So this is inadequate access to food because of financial constraints. And this really became at the forefront of my mind in discussion with families. As this infogram shows, inadequate access to food can result in poor intake of nutrients, which puts you at risk for chronic disease. And for pregnant women, this increases pregnancy risks. As we've seen in children, poor nutrition can lead to cognitive and social emotional deficits. And long-term, we see a lot of mental health issues, whether anxiety, depression, or substance use. So it does have a long-term health impact when you don't have a reliable food source. Next slide. Although the public charge rule did not include disaster emergency services, unfortunately, FEAR extended to those services during COVID. I was in Chattanooga during the pandemic, and in my observation, the anti-immigrant climate that was created with public charge was a factor in many people getting COVID testing and care. As many people know, COVID has disproportionately affected minority groups, especially immigrants. And I remember in the beginning of the pandemic, here in Hamilton County, where I live, 65% of our cases were in the Hispanic population, which is our largest immigrant group, although they only account for 6% of the population. And these alarming statistics brought to attention a lot of underlying inequalities, but I think a lot of opportunity for change, and particularly making the public aware that there is free testing and clinics available to everyone, regardless of citizenship status. Next slide. This diagram is a good illustration of how a political or cultural change can influence one's environment and ultimately the health and well-being of children over time. So for example, with public charge, when you have a large cultural political change, you have a lot of anti-immigrant discussions and sentiment in the community. And on an environmental level, this may change people's actions. So people were fearful, so maybe they didn't enroll in WIC or SNAP, so they had food insecurity. Maybe they didn't enroll in TennCare because they thought that'd be used against them. And then just a general sense of fear and distrust in the government, knowing, is this going to change? Does this apply to me? And what we see over time through a lifespan of a child, this, what we call toxic stress, has effects both on their physical and mental well-being. And over time, we see that build. And so cases of anxiety, depression, PTSD, poor school and performance increased. And I can say during that time period, unfortunately, I don't think a week would go by that I didn't talk to a suicidal child, which was alarming to me. And I do feel like this did play a factor, the anti-immigrant culture. And so this kind of just ties together how a policy can influence overall health. Next slide. So what can we do? So how do we empower families? A big thing is helping them know their rights. So a lot of you here are working in the community, working with immigrant families. In a prior discussion I had with pediatricians, I thought this website was a great resource. A lot of education materials available in multiple languages for different audiences at a low literacy level. And it's a good tool to use to educate who it applies to, what services they can use. If you have children, how does that process work? And so I encourage you to look at that. And then building rapport. When you know families, talk about factors that may influence their use of benefits. And Dr. Bilistowski, who's going to be speaking next, is going to give you some more practical tips on how to talk to families.
Okay, hi, thank you very much for inviting me. So my name is Adriana Valenzuela. I'm a Latina pediatrician at Vanderbilt Children's Hospital in Nashville that cares for Spanish-speaking children and their families. I am, as Sarah mentioned, the co-chair with in the Tennessee TNAP. And I think I have to give a lot of Sarah did all of this, and I just want to say that she did a fabulous job in getting everybody together. So today I will be focusing in the Latino population, since it's the population I mostly work with. But I think many things that I've talked about will be similar to issues in other population. Research has lumped Latinos into one group, but even though there's a lot of commonalities, there's also great variability. So I am begging that don't stereotype, but I will try to focus on some of the difference. And I will be using the term Latinos and Hispanics interchangeably. Next slide. So Latinos represent 18% of the US population. Most of them are US citizens. The unemployment rate of pre-COVID was comparable to non-Hispanic whites. It has increased a lot because of the type of job that they use after COVID. However, Latinos live in high poverty. Latinos have the highest uninsurance rate, and this is because of the type of jobs they're doing. And they have a very high percentage of food insecurity compared to the national average. Next slide. So I know we're talking about public charge, but we really need to understand that even before public charge, and despite the high levels of poverty, Latino families were the less likely than any other racial and ethnic groups to apply for some type of public assistance programs, even though they were eligible. So public charge increased what was already there. Although the reasons for not applying are poorly understood, it's really important to understand so we can address some of these. So Latino families face several obstacles, which are immigration status of family members, the mixed status families, English proficiency and language literacy, navigation of systems and the administrative burden that means, and racism and anti-immigrant sentiment. I will expand in the topics about that. Next slide. So 1/4 of children in the US are Hispanic. Most of the Hispanic children are born in the US. 1 in every 4 Hispanic children resides with an undocumented immigrant parent. And as you can see in the figure on the right side, it depends on what country they come, but definitely a lot of families from Central America have a lot of parents that are non-documented. Next slide. So on top of all the issues, we need to add the negative effect of public charge. So the Urban Institute surveyed immigrant families, which include mixed family status. And they report the chilling effect was more than twice as high in Hispanic adults living with immigrant families than non-Hispanic whites and non-Hispanic non-white living with immigrant families. So it really targeted Latino families really very hard. Next slide. So as I mentioned before, another reason why families may not be applying is language barriers. English proficiency has improved dramatically, but it is driven mainly by Hispanics born in the US, but not by foreign-born Latinos. It really varies from the country they come from. And so as you can see in the figure on the right, again, the prevalence of poor, not speaking English proficiently, it targets a lot of Central Americans. And we are seeing in Tennessee, at least in our clinic, a big influx of families that are coming from Central America. So public charge explanations are difficult to understand in English by itself. So you can imagine how difficult it was trying to understand it in Spanish. I was like, who do they classify, who falls within it? It was very scary for the families. It is important to understand that even though the forms are in Spanish, it is really hard to understand what they are because literacy levels are sometimes low. And we make things at literacy level of 6th grade here or 3rd grade here, which are many of our families don't even have that. And the application to many of the services have barriers. For example, the caseworker might not speak Spanish, right? Next slide. So racism plays, and anti-immigrant sentiments have played a big role in everything, and that's prior even the public charge. So there's been a lot of research saying Hispanics are imposed more barriers to successful claims. They are subjected to more scrutiny, and they may not be given the full information of the benefits. Next slide. So to be most helpful and build empathy, it's important to understand the barriers, fears, and factors families encounter. This will allow us to be able to discuss and understand their concerns. Parents are proud, may feel guilty of not being able to provide what is needed to their families, despite working very hard and contributing to an economy. We need to understand that, for example, based on an American Community Survey of 2015, the Hispanic immigrant community contributed greatly to entitlement programs. It is thought that the taxes of their individual wages contributed to 11 billion for Medicaid and 16 billion to Social Security. So they are contributing very hard and they are not receiving the benefits. So many times when I talk to families, I really enforce the fact that they are working and they deserve this right. So to understand their concerns and can lead a more productive conversation, we need to do certain things. One of the things I do is contextualize. I do ask open-ended questions, but if you don't ask a little bit more, they are dismissed. People don't want to talk about it. So I ask questions about the process, show you care by asking questions that show you're interested in helping them. For example, did the lady in the office speak Spanish? Did you understand what it was written? Are there costs that you are not being able to fill to get your WIC or SNAPs? That the burden of documentation is an issue. So for example, it's very typical that the last Social Security number and they don't have, but there's many other ways that they can apply to things through other IDs. So I ask about prior discrimination experiences because that does cause a big fear of going into places. I ask about very straightforward, are there issues about being afraid of being stopped by ICE, being while they're driving to the place or while they are in the offices? I name what it is, and I ask them carefully, not hurting. So the way I do that is I encourage. I say, it may feel the information required is intrusive, and I understand you may not like to disclose sensitive information, but the reason why I'm asking these questions is because I can understand where I can help you, right? And the other thing I always say, I do not document what this is, your legal status. And I tell them what I will do with it. So I'll get my social worker to come and talk to you, because this way we understand what services we can offer. I do have to always remember to check that I'm understanding what they are saying and what their concerns are. Check my biases to make sure that what I'm hearing is exactly what they are saying. I want to make sure that they understand what I'm trying to say. Many of the parents are don't like to disagree with you. They use that as a respect. So many times I have to build a space where they can ask the questions. The other way is I soften things. I'm not sometimes as direct. I am very polite, because parents might say, I don't need the assistance. Other people need the assistance more. But I tell them, this is your right. You're working, you're doing what it is. It's a bad situation, especially with COVID. There is a lot of depression and feeling as failure for parents. So ask about how the parents are. Parents live in a very complex household situation. They live with other people, they get money, support from one parent with another parent. So make them understand that that's okay, that we all live in different ways, but we need to know that information. One of the things I'm always very interested in, and I find many of these families need, is how to manage their resources and where are they getting their information. I find that word of mouth is very important in this community, but they still believe in the physician, they still believe in many organizations. But we also have to be careful, because there are places that they get, they're not truthful to the families, if I would say another thing. And one of the, another very interesting thing is the lack of women's knowledge of their financial situation. So I see this as a great opportunity to address issues that are still lingering in our society. Thank you.
Thank you. I want to talk a little bit about the impact we saw the chilling effect had on TennCare and Cover Kids, which are Tennessee's Medicaid and CHIP program, and then talk about a few other healthcare coverage options. So I think it's very important that you talked about why how we can talk to families, and this is kind of why we need to talk to them, because the participation rate and the programs that they are eligible for is not as high as it should be. Let's see. So first, this is some research done by Urban Institute. It kind of really shows the chilling effect and how it was more than just a hesitancy to use benefits. It was an actual decrease in the usage. So in 2016, child uninsured rates were at historic low levels, and it started increasing as early as 2017, which was when that public charge rule was even first mentioned. And the uninsured rate increased for all children, but as we can see, it was way more pronounced for citizen children who had non-citizen parents. And I do think it's important to note for between the first two sets of bar graphs is that both sets of children are citizen children, which means that they have the same healthcare options available to them. However, the difference is that for the first set of bar graphs, it is citizen children with only citizen parents. And then for the second set, you have citizen children who have any non-citizen parent. And we can see in 2019, when we look at the difference between citizen children with only citizen parents and citizen children with any non-citizen parent, those with a not citizen parent, their uninsured rate doubles, despite them having the same healthcare opportunities available to them. In Tennessee, we can really see this when we look at Latinx children uninsured rates, which is 17.7%, while for children overall, the uninsured rate is 5%. And nationwide, 94 or 95% of Latinx children are citizens, but about half of them have at least one immigrant parent. And then when we look at those that are uninsured nationwide, almost 2/3 of them have an immigrant parent. So we can clearly see that when immigration status, citizenship status becomes a factor, even if it's not a factor for the children themselves, if anyone in the household, their parents, this becomes a barrier for them accessing the benefits available to them. And for the second set of bar graphs, I really want to hone in on the fact that a lot of children aren't eligible but aren't enrolled. And we see with this one, it shows the participation rates in Medicaid and CHIP for eligible children without other health insurance coverage. And again, we see in 2016, the participation rates were higher for both sets of children. And then in 2019, it decreased for both sets of children. But again, for the citizen children with any non-citizen parent, their participation in Medicaid and CHIP, even though they were eligible, decreased more than the participation rate for those citizen children with only citizen parents. And in Tennessee, in 2019, there were about 44,000 children who were eligible for Medicaid or CHIP, but were not enrolled. And when we think about ways that Tennessee can go towards increasing the participation rate in its programs, it can adopt policy changes such as 12-month continuous coverage, which would give children coverage for 12 months straight, regardless of any income changes, job changes by their parents. And another thing Tennessee can look into doing is waiving the 5-year bar. The 5-year bar applies to TennCare and Cover Kids, as well as a few other public benefits. And it basically says that certain non-citizens, particularly lawfully permanent residents or green card holders, are not able to access TennCare or Cover Kids until they've had that status for 5 continuous years. And states actually have the option to waive this 5-year requirement for pregnant women and children. And Tennessee has not taken up that option for Medicaid or children on Cover Kids. While pregnant women on Cover Kids, there's no citizenship requirement for. 35 states have actually already waived the requirement for Medicaid or CHIP. So Tennessee should join them. And I think it's really important because, again, when it comes to the uninsured rate for lawfully permanent resident children, their uninsured rate is 21%. And that's compared to that, if we see that 5% for children in general. So it's way higher than that. So first, now I want to just talk a little bit about the healthcare programs available here in Tennessee. So the first one, of course, is TennCare, which is Tennessee's Medicaid program. TennCare is available to U.S. citizens, U.S. nationals, and qualified non-citizens. The qualified non-citizen category is a bit broad, and I don't really have the time right now to go into it, but it includes lawfully permanent residents after that 5-year bar, asylees, certain asylees, certain refugees, and other categories. I do want to note it does not include undocumented individuals. I did recently put out a blog that I'll link to when I send the slides in the recording, talking more about the qualified non-citizen category, as well as some of the other healthcare programs I'll be talking about. Again, and then I do want to make sure I note that when it comes to Medicaid, the usage of TennCare or Medicaid is only counts as a public charge and a public charge determination when Medicaid is used to pay for long-term care. For example, if someone was in a nursing home or a long-term residential facility. I want to make sure I note that usage for everyday doctor visits, hospital visits, ER visits, prescriptions, things like that will not count against someone in a public charge determination. And then in terms of the importance of Medicaid, particularly for children under 21, if they're able to give Medicaid, it provides a coverage called EPSDT coverage, which stands for Early Periodic Screening, Diagnosis, and Treatment, which essentially says, it's a set of federal guidelines that says Medicaid programs must cover whatever is medically necessary for anyone under the age of 21. And it's really a great program to make sure that the children on the program on Medicaid are able to get all the services they need. And additionally, other wonderful benefits of Medicaid, when we look long-term, it's a well-documented research showing that the long-term impact of Medicaid, there are many positive benefits to having Medicaid in the long term, such as better overall health later in life, fewer chronic conditions such as high blood pressure, heart disease, fewer hospitalizations, better oral health. And there are also improvements when it comes to lifestyle and socioeconomic status. People have increased income in adulthood, increased high school graduation rate, increased college enrollment, increased attainment of bachelor degrees. So having Medicaid really does have a positive effect on children's life, later life, and it provides many great benefits. So now I want to just mention briefly a few other healthcare options available to both citizens and non-citizens. So Cover Kids, as I mentioned, it is Tennessee's CHIP, so the Children's Health Insurance Program, and it is another public comprehensive coverage option. However, unlike TennCare, it is not completely free. For children, it has some low co-pays, but for pregnant women, it doesn't have any co-pays, so for them, it's basically free. And another difference between Cover Kids and TennCare is that, for TennCare will cover whatever is medically necessary. Cover Kids will not always do that. It is comprehensive coverage though, so it will cover mostly everything that someone needs. When it comes to emergency medical services, this will provide Medicaid coverage to cover life-saving procedures for someone. And this is for individuals who would be eligible for Medicaid, but they aren't due to their citizenship status. And another thing, Children's Special Services, so CSS, it will cover care coordination and certain medical services for children under the age of 21 who have special health care needs. And it has income limits, but it does not have any citizenship requirements. Another good program is the Tennessee Early Intervention System, or TEIS. It is for children under age 3 who have developmental delays and disabilities, and it helps connect them with services that they may need to improve their development. And there are no citizenship requirements for it either. And then let's see, free and low-cost clinics and health centers, they're all across the state. If you would like help finding one near you, you can feel free to contact the Tennessee Justice Center and we'll be happy to help you do that. And then before I hand it over to our nutrition team, I do want to make sure I mention that private insurance through parent employers, other relative employer, they don't have any citizenship requirements. Like, it is kind of sad that a lot of immigrant workers work jobs that don't have access to group healthcare plans, so this isn't always an option for them. And then when it comes to the federal marketplace, which you can access on healthcare.gov, the citizenship requirements are a bit broader than they are for Medicaid. I talked a little bit about that in my blog post as well. And also the marketplace will cover those in the 5-year bar. It will allow them to get cost sharing and premium assistance over there on the marketplace while they're in that 5-year bar. Yeah. I'll hand it over to our nutrition team.
Hi everyone, my name is Emily. I do nutrition advocacy at TJC. Thank you for joining us this evening. I'll be quick. Sarah did a great job touching on a lot of the food assistance programs, so I'll just give a little overview and talk a little bit too about PEBT, which is something that we do a lot of work on the nutrition team at TJC. So PEBT, for folks that don't know, is a program that replaces free or reduced price meals lost due to COVID-related absences. So before the pandemic, when kiddos were always going to school, they could get those free or reduced price meals at school and eat them there. But then the pandemic happened and virtual learning or absences started happening, and the government created benefit cards to replace the monetary value of those meals lost during the pandemic. I just wanted to give a couple updates on the program and also flag some important reminders for parents or students or folks who are working with parents or students that receive PEBT. So PEBT for this school year, the 2021-2022 school year, is not yet available. I can give Heaven a link to our email alerts, but we'll send out more information as soon as we know more about who will be eligible for that and when to expect it. We do know that it is a requirement to be on free or reduced price school meals to receive PEBT, and we have heard from a lot of partners and families that especially non-English speaking folks have not seen any resources pointing them to sign up for free or reduced price meals or reminding them to get PEBT. So that's a big communications push that we've been working on, as well as having parents keep the round 3 cards. So round 3 was for this past summer and the school year, a good chunk of the school year before that. And the Department of Human Services that administers this program is requesting that folks keep those round 3 cards. So if anyone is working with families or anyone on this call receives PEBT for their child, just remembering to sign those kiddos up for free reduced price school meals and also keep that round 3 card so you can get benefits faster next time around. You can go to the next slide, please, Evan. And then I'll just do a real quick overview of SNAP and WIC. I wanted to talk a little bit about the specifics of who's eligible. Sarah did a great job of kind of explaining the program. So immigrants with a lawful permanent residency or a green card for 5+ years, children under age 18 with LPR/citizenship with no 5-year waiting period, and most refugees with no waiting period. So like we were talking about earlier on the call, the Supplemental Nutrition Assistance Program is meant to be kind of a little boost in buying groceries for the month. There was recently an increase to the benefit that we've been talking a little bit about, but certainly is not nearly enough to buy enough groceries for the year, or for the month, I mean. But folks have been receiving the maximum SNAP allotment during the pandemic, and that has continued through this month as well. So just getting the word out about it, and then also just outreach like we've been talking about on this call to make sure that folks know that public charge does not apply when they are applying or receiving SNAP benefits. Go to the next slide, please. And then I just want to talk about WIC real quick too. WIC is a lot less restrictive than SNAP as far as immigration requirements. So Tennessee residents are eligible. There's no social security number necessary. It provides healthcare referrals, breastfeeding support. Fathers can also apply for WIC on behalf of their children under 5. So this is also a really important program. Right now, all of the applications and appointments and everything are being done over the phone. So I put this little graphic in here in case anyone's working with folks who might be interested in applying. But that's all I have. I'm happy to answer any questions, and I can put my email in the chat box too if anyone wants to connect on PEBT or communication efforts on PEBT after this.
Thank you, Emily, and thank you everyone else for presenting. So I'll just wait a few seconds and see if anybody has any questions. Please put any questions you have into the chat box. So I'm not seeing any questions, so I'll go ahead and close out. So thank you again to Turk and Tina. Thank you, Emily, as well, for presenting and sharing all this wonderful information. Everyone feel free to contact us if you have any questions that come up after this at trainings@tnjustice.org. As a reminder, I'll distribute the slides and recording, as well as the vlog I posted and Emily's information about PEBT tomorrow. And also please feel free to sign up for our other upcoming events. On October 28th, we have food assistance for immigrants and refugees, where you can learn more about the available stuff for SNAP and WIC. And then November 17th, we'll be talking about ECF Choices, which is, again, a program for those with intellectual and developmental disabilities, a way to give them TennCare and home and community-based services. Thank you all, and have a good night. Oh, I think someone has a question, sorry. They said, will you all be doing a seminar related to adversaries the Asian community faces as well? We do choices trainings here and there, so feel free to sign up for our training and independence emails. I can reach out to you with the link for how to get on those listservs and see what upcoming trainings we'll have for that category of individuals. But thank you. Have a good night, everybody.